Today we will discuss about the anticonvulsants, including the phenytoin and carbamazepine. First of all, we will discuss these are the anticonvulsants that are used for focused seizures and have the narrow spectrum, while the other one that is used in absence seizures only is ethosuximide, and then broad spectrum anticonvulsants include the valproate and lamotrigine, levetiracetam, and topiramate. So first of all, phenytoin and carbamazepine. So phenytoin and carbamazepine both are sodium channel blockers and causes sedation, dizziness, diplopia, and phenytoin also causes gingival hypertrophy that is preventable with folate supplementation, and phenytoin causes rash, hirsutism, drug interactions, and both phenytoin and carbamazepine are CYP450 inducers. Then phenytoin and carbamazepine both causes hepatotoxicity, both causes Stevens-Johnson syndrome, and also causes the drug reaction with eosinophilia and systemic symptoms, that is DRESS. And phenytoin causes neuropathy, osteoporosis, folate depletion, and teratogenicity, while carbamazepine causes agranulocytosis, that is important adverse effect, agranulocytosis, aplastic anemia, folate depletion, and teratogenicity. So common is folate depletion, that is caused by phenytoin and carbamazepine, and also the teratogenicity, but important for carbamazepine is agranulocytosis and aplastic anemia. And then we will discuss about gabapentin pregabalin, that are gabapentinoids, and block calcium channel, causes sedation, dizziness, ataxia, weight gain. Then the ethosuximide that is used for absence seizures only, and it is also calcium channel blocker, just like the gabapentinoids. Gabapentinoids block calcium channel, and ethosuximide also blocks calcium channel. And adverse effect of hydroxyamide is sedation, dizziness, and vomiting. And previously, we have seen that gabapentin and pregabalin causes sedation and dizziness, and other than that, ataxia and weight gain. So, weight gain because of these gabapentin and pregabalin that are used in neuropathic pain and severe pain, especially the pain with the diabetes, that is neuropathic pain like in the foot. Then the other one thing is broad spectrum seizures for focal and generalized seizures. The broad spectrum medicines include the Valproate, Lamotrigine, Levetiracetam, and Topiramate. So Valproate blocks sodium channel, blocks calcium channel, and blocks GABA transaminase blocks GABA transaminase, block calcium channel and sodium channel, and also the adverse effects to somehow similar to the previous one, like sedation, dizziness, and vomiting, and also valproate causing weight gain, just like gabapentinoids. So weight gain, hair loss because of valproate, easy bruising, drug interactions, and CYP450 inhibition. So CYP450 inhibition is done by valproate, by carbamazepine, by phenytoin, and then in adverse effects, valproate is also causing hepatotoxicity, just like phenytoin and carbamazepine. So valproate causes hepatotoxicity, pancreatitis, teratogenicity, the highest risk of all the anticonvulsants. All the anticonvulsants result in teratogenicity. So then we will discuss about the lamotrigine and levetiracetam, that are the safe anticonvulsants in the pregnancy. These two, one lamotrigine and levetiracetam. So lamotrigine blocks the sodium channel, just like phenytoin and carbamazepine. So lamotrigine blocks sodium channel, and it results in sedation, dizziness, and rash, and also Stevens-Johnson syndrome and DRESS, that is drug reaction with eosinophilia and systemic symptoms. Levetiracetam blocks synaptic vesicle protein 2A, synaptic vesicle protein SV2A, synaptic vesicle protein SV2A, and it results in sedation, dizziness, and fatigue. And adverse effect is neuropsychiatric, for example, psychosis. So levetiracetam can result in psychosis. Then the last one, that is topiramate, that blocks the sodium channel, potentiates GABA A receptor, and GABA A receptor. So here it potentiates the GABA A receptor, and it can result in adverse effects like sedation, dizziness, mood disturbance like depression, weight loss, paresthesias, and severe adverse effects include the kidney stones and angle-closure glaucoma. So these are slightly different adverse effects like kidney stones and angle-closure glaucoma by topiramate. And also here we discussed that topiramate potentiates the GABA A receptors. So I can remember that GABA A receptors uh, are actually GABA A receptors. On GABA A receptors, some in you can say zolpidem medicine, that is a non-benzodiazepine uh, sedative, that also acts on GABA A receptor. Yes, that act on GABA A receptors, zolpidem, that is used in insomnia, but that is non-benzodiazepine.